Serratus posterior superior, posterior inferior. Serratus, we have also what muscle? Anterior. It lies here on thorax. Anterior. This is posterior serratus. Serratus, it has these four ribs, but they are attached to the ribs. Upper serratus and inferior. Lower. Serratus posterior superior, serratus posterior inferior. 3 layers of superficial muscles. Origin, insertion. Deep layer muscles. Deep layer, they are also arranged in 3 layers. And together with deep layer, we will describe posterior surface of the neck, which is called the nuchal region. Posterior region of the neck, functionally connected with back muscles. That is why when we say neck, for example today, head and neck muscles, we will describe only anterior part of the neck. The posterior is functionally connected with the back, described with back. Neck, under the neck, we understand this part of neck, this nuchal region, back region. Connected with it. Here we have also 3 layers of muscles. Superficial is the strongest muscle of back, erector spinae. It has a very wide origin on dorsal surface of sacrum, sacrospinal sacrotuberal, iliac crest, spinous process of the lumbar vertebral teres, and attached to the ribs angles, iliocostalis, between angles and transverse processes, and to the spinous process, like longissimus and spinalis. It has lateral tract, intermediary, and medial. 3 parts of iliocostalis, erector spinae, iliocostalis, longissimus, spinalis. And each part in turn, each tract, the lateral, intermediary, and medial, has proper lumborum, thoracis, cervicis, thoracis, cervicis, capitis, thoracis, cervicis, capitis. 3 parts. Extension of the erection, the extension of the vertebral column, this muscle. Next layer under this, together with these what muscles of the neck? Splenius capitis and splenius cervicis muscles. They participate on one side, bending on the same side, abduction of the head, and both side contraction causes extension of the head and neck. This is flexion, this is extension. More deeply allocated transverse spinalis muscle. From transverse process they go to the spinous process. That is why general name of this muscle is transverse spinalis. Under the transverse spinalis we have 3 types of muscles: semispinalis, multifidus, rotatoris. Semispinalis, they are more longer. They overlap through the 4-6 vertebra. From transverse go through 4-6 vertebra attached to spinous process above located vertebra. Multifidus, they over through the 2-4 vertebra. And rotatoris attached to the same or 1-2 above. 1 above or 2 above located spinous process. 1-2, 2-4 and 4-6. More deeply, just on the vertebra, what muscles are located? Which are located between transverse process or between spinous process? Interspinous, intertransverse. And the same layer, deeply allocated muscles of posterior group of neck, they are called suboccipital muscles. Suboccipital muscles, these muscles. Rectus, capitis, posterior, minor, major, obliquus inferior, obliquus superior. Between atlas, axis, and nuchal inferior line, we have these muscles. 2 straight, major, minor, and oblique. Obliquus inferior, obliquus superior. On the thorax, what muscles we have? Amphitheater thoracolumbalis, which covers these deep muscles, erector spinae. What muscles on the thorax we have? Superficial, deep. Superficial 4 muscles, and deep mainly 4. Superficial, what muscle is this? Major, which is covered by a superficial lamina of fascia pectoralis. Below lies what muscle? It has sternocostal, clavicular, sternocostal, and abdominal portions attached to the crista tuberculi majoris. What muscle lies under the pectoralis minor? Pectoralis minor, which is covered by deep lamina of the fascia pectoralis. Then what muscle lies between clavicle and first rib? Subclavius. And this muscle is serratus anterior, anterior serrate muscle. Serratus anterior. Four muscles. What? Once more name. The most superficial is what? Major. Below lies minor. Then subclavius and serratus anterior. Serratus anterior, like posterior, from upper 8-9 ribs goes to the medial margin of the scapula and rotates the scapula. When the inferior angle of the scapula rotates, it is called rotation of the scapula. And when the scapula is fixed, it facultative muscle of respiration, inspiration. Deep muscles. Deep muscles, they are external intercostal, internal. External goes from upper rib to lower. They raise the ribs. And internal, they descend the ribs. And also behind sternum, we have transversus thoracis. Subcostalis, on posterior wall of the thoracic cavity, we have subcostalis. On anterior wall, the sternum. From inside of sternum, what muscle we have? Transversus thoracis, and transverse direction. Remember, the same direction have muscles of abdomen. Like what muscles? Muscles of the thorax, deep muscles, they are called the proper muscles of thorax, aborigenic muscles, autochtonic muscles, muscles which start on the ribs, attach to the ribs, start on the ribs, attach to the ribs. Superficial muscles, they pass between upper limb, and through the girdle and upper limb and trunk. But the proper muscles, autochtonic muscles, they start on the rib and end on the ribs. This same direction have, remember, muscles of the abdomen. Only division of subcostalis muscles is over 1 or 2 ribs and lies like internal intercostal, lies on inner surface of the thoracic cavity, only on posterior inferior part of thoracic cavity. And of course we have levatorus costarum muscles, but function of elevation of the ribs is not so important of this muscle. Levator costae, which extends from angulus costae to transverse process, elevates the ribs. Levator costae. Now, muscles of abdomen. In distinction from the thorax and back, what group of abdominal muscles we can distinguish? Anterior. Anterior group, what muscle? Don't study that, don't prepare home test. What muscle? How to this know? Rectus abdominis and pyramidalis. Anterior group. Lateral group. Lateral. Anterior, lateral. In the thoracic region. Thoracic, on the chest. What group of muscles? Once more name. Group, muscular group of the chest. What group? Superficial, deep. Muscular group of the back. What group? Also superficial. You don't listen, that. But just before I have explained and ask you once more, you could not answer. Muscles of the back. What group? Superficial and deep. But muscle of abdomen in distinction from thorax and no superficial dip. Here we have three groups: anterior, lateral, posterior. Anterior, two muscles, lateral, three muscles, and posterior, only one muscle. What muscle lies on posterior? Quadratus lumborum, between 12 rib and iliac crest. On this muscle, like kidney, our kidney on the back. Here, inside of abdominal cavity, we have what muscle? Quadratus lumborum. Depressed, participate in expiration, this muscle, and participates in flexion of the vertebral column also. On anterior wall, what muscles we have? Rectus, which has multi-belly muscle, many belly, 4 belly, separated in distinction from other muscles. This muscle has 4 belly, intersectiones tendineae separate. And below, musculus small pyramidal muscle. Lateral wall of abdominal cavity are formed 3 muscles, 3 wide muscles. All this lateral wall is formed by 3 muscles. Name these muscles. At first, they are oblique, external oblique, then internal oblique, then transverse abdominal, no oblique, transverse abdominal muscles. And for understanding origin of insertion, you must turn your attention how they pass, their fibers pass. I will turn your attention that direction, orientation of muscular fibers in abdominal region is very important for stability, dynamic stability, and steadiness of the abdominal wall. Here, like architectural construction we have in our abdomen. Muscular fibers go from upward to downward. Thus, this muscle start from what? From 8, 9 ribs low. Come from second, third until 12. That is why their fibers pass inside of what muscle? Serratus anterior, upper part, below latissimus dorsi. In this direction, muscle goes from the ribs, goes where? Iliac crest, labium, externum, and then continues with what muscular part? Continues with tendon. After attachment of here, it is attached from iliac anterior superior spine to tuberculum pubicum. Tuberculum pubicum. These muscular fibers continue with tendon. Tendon of white muscles on the trunk. What name have? They are not narrow tendon as on limbs, upper limbs, lower limbs. They have narrow on the limbs, but on the trunk, muscle is white, tendon also is white. White tendon of muscle of the trunk is called name. What is it? Aponeurosis. What is this? It is tendon of muscle. This muscle has this white and wide tendon. This, you will see, starting from the 8-9 ribs, some part of fibers attached to iliac crest, and continues with aponeurosis, which on midline from crossing fibers and participate in formation of linea alba. And below, aponeurosis is attached, stretches from spina iliac anterior superior until tuberculum pubicum. And what structure form? Inguinal ligament, ligamentum inguinale. Inferior, what does it mean? Definition of ligamentum inguinale, how you will give? Ligamentum inguinale is formed by lower fibers of aponeurosis of obliquus externus muscle, external oblique muscle, low fibers of aponeurosis, which extends from spina iliac anterior superior to tuberculum pubicum, between spina iliac anterior superior and tuberculum pubicum. Can you once more repeat? What does it mean, inguinal ligament? You're physically present, but don't listen. Switch off your mind. What? External oblique muscle? No, it's Aponeurosis by low fibers of its aponeurosis, which extends from anterior superior to tuberculum pubicum, between these 2 points attached, and forms inguinal ligament. Ligamentum inguinale is formed by what fibers? Lower fibers of what? Which is superior anterior iliac spine to tuberculum. Revised pelvic oscopse, hip bone. You don't remember the bones, my dears. If you forgot about this, every time revise this one. This spine iliac anterior superior. This tuberculum pubicum. Between them stretches this ligament. Да? This point and this point. Two prominent. Wait, spine iliac anterior superior. So, spine iliac anterior superior and tuberculum pubicum. If you will connect these 2 points, what ligament we will receive? Inguinal ligament. But inguinal ligament is formed by what structure? You will explain. Low fibers of external muscle. When we have studied this pelvic region junction. Here is absent, but here also you can draw this inguinal ligament. It is not drawn here. And above this ligament lies inguinal canal, which has 2 openings and 4 walls. Under this muscle, do you understand? Orientation of fibers from upward to downward, like what muscle of thorax? What muscle of the thorax goes in the same direction? Intercostalis externus muscle. Externus. Intercostal external muscle has the same direction as this obliquus externus. Below located. And obliquus internus has the same direction as intercostalis internus. That is why from what part you will start origin? From? Give me some guess. No, obliquus internus muscles. Where it starts? From obliquus internus muscle from what? From? In what direction it will go? This goes from upward to downward. And intercostal internal go in opposite direction. That is why from what structure you will start? It is attached from what to what? Спасибо. Да, спасибо.
Нелли Алексеевна, в 3:15 лекция. Удобно?
Очень. Ну, в 3 отпустим, а они 15 минут будут собираться.
Я говорю, лекции вас.
Спасибо. Но видишь, эти я не читаю сегодня. Что-то придумал. Не, ну туловище я читаю. А почему туловище?
Ну да, правильно.
Не пугай меня. Предлагали тем самым, потому что после а после зачета я буду читать. Может, там удастся куда-нибудь
daripada di bawah daripada dia tak lah from upper to lower
когда они придут тебя
tapi cakap from upper to
я
lower
могу, но имею ли право?
abdomen lah kan ini tengok ni pergi atas ni pergi bawah
Светлана Валерьевна тоже же.
kan dari mana ni dari mana
Анастасия Анатольевна,
tak
Валентина Александровна не трогать, она уже
aku tak tahu
Yang ni internal, internal.
okey ni internal
Yang ni external. So dia macam berlawanan. Kalau external up, low. Kalau ini